Okay, so in this lecture, I'm going to discuss the neurobiology of cannabis as well as, or cannabinoids really, and as well as their short and long-term effects. Marijuana has a number of different compounds in it. It has some that are psychoactive, some that are not. The main psychoactive compound is delta 9 tetrahydrocannabinol, or THC, so widely known. THC is rapidly absorbed through the lungs, which is why it's preferentially smoked. Onset of action of marijuana is actually several minutes, so very relatively rapid, with peak concentrations achieved somewhere between 30 to 60 minutes after smoking. And the effects are relatively long lasting. They last about 1 to 3 hours when smoked. Obviously there's been sort of a movement towards edibles and oral ingestion. So it's important to note that oral ingestion has a slower onset, usually takes 30 or more minutes before the effects are felt, and it's also far more inefficient. Despite its inefficiency, the effects can actually last for several hours. And one of the things that's sort of interesting is that because of the delayed onset, users may inadvertently take more or higher doses of the drug than they intend to, because they ingest it, don't feel anything, so they take a little bit more, thinking maybe they didn't take enough, and they ingest more, and so then they end up taking more than they originally intended, and they actually begin to experience some of the negative effects. In fact, there was some really interesting reports that the rates of ER admissions due to marijuana were increased in those states where marijuana was legalized. And the suspicion is that people who went to these states for quote unquote drug holidays ended up ingesting more of the drug, and then as they were coming down, experienced anxiety and panic attacks, thought they were having a heart attack, and ended up in the emergency room. So something to think about when using is to expect that the onset will be considerably slower. THC is actually quickly metabolized, but because it accumulates in body fat, its clearance from the body is relatively slow. It takes about 80 to 90% of the cannabinoid or THC metabolites are excreted within about 5 days, but we know that it can remain detectable in the body for up to 30 days, depending on the extent of use. All right, so the rewarding effects. So there are two cannabinoid receptors in the brain. The two cannabinoid receptors in the body. Okay, so there are two cannabinoid receptors. So there's actually an endogenous cannabinoid system that has been identified in the brain, and there were two cannabinoid receptors that have been identified. They're called CB1 and CB2. CB1 are located primarily in the brain, spinal cord, and periphery, whereas CB2 are located primarily in immune cells. So not surprisingly then, the effects of cannabinoids tend to be mediated by the CB1 receptor. In addition to that, the neurotransmitter that, or the chemical messenger that mediates the effects of marijuana and works at these receptors, is called anandamide. And as you can see, this slide has the chemical makeup, or the chemical makeup of both THC and anandamide. And what you can see is they're, although not identical, chemically very, very similar to one another. And so not surprising that THC can operate at the anandamide receptors, or the CB1 receptors. So research has shown that anandamide is involved in experiences of pleasure, memory, thinking, concentration, movement and coordination, as well as sensory and time perception. All of these things make sense given what we know about the sort of physiological and psychological and behavioral effects of marijuana. What's interesting is that the mechanism of THC's rewarding effects are very similar to that of opioids. And so I'm going to kind of slide over here to that graphic. And so before I run it, so THC binds to receptors on the presynaptic cell. which limits the amount of chloride ions, these negatively charged ions that enter the cell at the GABA receptor. By inhibiting GABA's inhibitory effect on dopamine, we see an increase in the amount of dopamine that's released into the synapse, which is what causes that biochemical cascade leading to increased feelings of pleasure. So it's been a while probably since you've seen the graphic for opiates, so I'm just going to rerun it. GABA is released. Chloride ions are allowed in the cell. They're inhibiting the amount of dopamine that gets released. So they're basically serving as a gatekeeper for the amount of dopamine that's released, keeping it at a level that would be considered normal and adaptive. So when someone has ingested cannabis, THC is going to bind to that cannabinoid receptor. GABA is released. The amount of chloride ions allowed in the cell are less, which sort of prevents GABA from inhibiting the dopamine release. More dopamine is released into the synapse, therefore more available for binding to that postsynaptic cell, and that's what produces that biochemical cascade. So in many ways, working the system of its reinforcing effects mirror quite a lot the opioid system. Okay, so going back to the slide, chronic use of marijuana actually can lead to culling of CB1 receptors in the brain's arteries. And what's interesting about this is that by culling those CB1 receptors, basically they die off or removed in some way, leads to reductions in blood flow to the brain. And due to these reductions in blood flow, the brain doesn't get adequate amounts of glucose and oxygen, and these glucose and oxygen are really, absolutely critical for normal brain functioning. So the results of this then are chronic, basically account for the effects of chronic use on attention, memory, and learning. Essentially, people who are using chronically experience attentional difficulties. They experience short-term memory loss, and because of that short-term memory loss, have difficulty learning new information. Okay. So just sort of talking a little bit more about marijuana's effects on the brain, we know that marijuana alters the functioning of the hippocampus, which is here. And if you recall, the hippocampus is the structure that's involved in the formation of short-term memory. It's really considered the working memory area. It also alters the functioning of the orbital frontal cortex, which is involved in the ability to shift attentional focus, both of which are going to be really critical for both learning and memory. It disrupts the functioning of the cerebellum and the basal ganglia, both of which are involved in motor coordination, balance, posture, and reaction time. And the one thing that's really important about this is that there's sort of the joke that, it's okay to drive under the effects of marijuana because even if you get into an accident, you're going so slow, you're not going to hurt anything. But the truth is that the impairment associated with marijuana is equivalent to the impairment people experience from other intoxicants like alcohol, and so they're just as dangerous. So marijuana is just as dangerous a drug to use while driving as alcohol would be, because the reaction time is so severely impaired and their coordination is so severely impaired. And you can look at some of these other areas that are affected. Obviously, it has an impact on the hypothalamus, which controls appetite, so not surprising that that would occur given the tendency to develop the munchies when one is under the influence. So, so some of the acute cognitive and emotional effects, you can read the slide, don't want to really get into it, but I did want to mention that the negative effects of marijuana are much more common when the individual uses higher doses than they're used to. So I mentioned this earlier, that when people ingest orally, because the rate of onset is so slow, they think they haven't taken in enough, so they take more of the drug, and that actually leads to these negative effects like anxiety, fear, and panic. It can happen when the individual is naive to the drug or when the drug has a higher potency than anticipated. So overall, it really is about dose effects. Higher doses are going to produce more negative effects. And that's going to be kind of a result of the person's method and pattern of use, if you will. Behavioral effects are pretty self-explanatory. We mentioned already, impairs judgment, motor coordination, reaction time, leading to a disproportionate number of motor vehicle accidents. And again, these are not minor accidents. They include both fatal and non-fatal accidents. Combining alcohol and marijuana can increase the risk of driving accidents and kind of the severity of those accidents, and they also can increase the risk of workplace accidents and injuries. And we'll talk more about that later in a little bit. Wanted to mention some of the long-term effects. So we've already discussed the increased risk of developing psychosis among genetically vulnerable individuals. Did want to mention some of the cognitive deficits associated with chronic use. So some of these effects may be reversible if once the person stops using. However, the reversibility likely depends on the age of onset of use and the chronicity of use. So how much, how long, and when use occurred. So most of the negative effects are due to chronic or heavy use during adolescence. And that's because the endocannabinoid system plays a really important role in the formation of new synapses during early brain development. And so obviously marijuana use will in fact interfere with that establishment of new synapses. Chronic marijuana use may also speed up age-related loss of hippocampal neurons. And again, we've talked about the role of the hippocampus in short-term working memory, and that may account for the impaired short-term memory that we see among people who are heavy marijuana users. With respect to functional impairment, there's some really interesting long-term effects of marijuana use. So some research has shown that fewer than 50% of heavy cannabis users, as compared to 80% of lighter non-users, had obtained college degrees despite similar educational backgrounds of parents. So whether that's a motivational issue or due to academic performance problems is unclear, but clearly academic attainment is impacted by heavy cannabis use. In addition to that, more than half of heavy cannabis users report an annual income that is less than $30,000 a year. So again, there's, in addition to academic underachievement, we also see employment underachievement. Chronic users report that marijuana has negative effects on their social life, physical health, mental health, thinking, memory, and their careers. And then finally, school-age children who were prenatally exposed to marijuana, i.e. mom smoked marijuana while she was pregnant. These children show gaps in problem-solving skills, memory, and attention span. Not surprising, we're seeing marijuana influencing brain development during the prenatal development period. THC may also be excreted in breast milk, so it may in fact continue to have an effect if the mother decides to smoke after the child is born, but while breastfeeding. Some of the health effects. So we do see an increase in heart rate by as many as 20 to 50 beats per minute when someone is smoking. However, the tolerance to those cardiovascular effects develops with repeated exposure. It's chronic tolerance. There is an increased risk of heart attack. It's actually 5 times usual in the first hour after smoking, but it's unclear whether this may in fact be due to medical use among older adults who have an increased risk of cardiovascular disease already. Although we mentioned earlier that it does increase the risk of workplace accidents, and it does also lead to an increase in the number of sick days that people use. And there is some research that has shown evidence of an increased risk of testicular cancer associated with marijuana use in adolescents. Okay, and then finally, the withdrawal effects. Again, these are pretty self-explanatory. You're going to see some of the opposite, right? So you get kind of that sense of well-being, relaxation that people get when they're using. So it's not surprising that you see irritability, mood and sleep disturbances, cravings, and restlessness and physical discomfort. So these symptoms really make sense within the context of as sort of opposite effects to the physiological effects that people experience when using marijuana.